Hi, you guys. Welcome to SLC Med Spa. Today we're doing our Learn at Lunch. We took a break from Learn at Lunch this summer, and we're going to start doing it again every Monday afternoon around 12:30. So tune in, and hopefully we can give you some good education on some solutions to things that may be bothering you, both on the inside, on the outside. Our most common procedure we do here in our clinic is doing Botox and Disport, and so we wanted to talk about that today, just what the difference is, how these medications work, and the different areas of the body that we can use Botox or Disport. So Botox, and everyone knows about Botox. Some people don't know about Disport, so we wanted to just talk about the differences between the two and how they work. So they're both Botox and Disport, they're both botulinum toxin, and they both work the same way. They're both the same medication. What they do is they block the signal from your nerve that goes to your muscle and tells your muscle to contract. So a nerve impulse goes down the nerve, travels down the nerve, and once the signal gets to the end of the nerve, a chemical called acetylcholine is released from the end of the nerve. That chemical goes over to your muscle and tells it to contract. All of this stuff happens just instantly. And what Botox does is it stops the release of that chemical from the end of the nerve. It doesn't damage the nerve. It doesn't damage the muscle. It just stops the release of acetylcholine, and then the muscles do not contract. Both Botox and Disport, they both are the same medication. They're both botulinum toxin. They both do the exact same thing. The difference between the two is Botox, for some reason, there's some subtle differences between Botox and Disport. Botox tends to freeze the muscle a little bit better. So if someone really likes just the frozen look, no movement, Botox is the better product. When we're treating between the eyes, this is an area where we like it to be completely frozen, and Botox maybe works a little bit better there. Just completely stops the movement, and then the wrinkles can go away. Disport gives maybe a little bit softer feel. It's almost like you could move the muscles if you tried hard enough with Disport, but they really don't move. So it just feels a little bit softer. They both last about 3 months. The first time you have them, have either Botox or Disport, it's going to last about 3 months. If you get it and you have the treatment done again before all the movement comes back, most of the time Botox and Disport will last about 4 months. If you let the strength completely come back and you have it injected again, it's only going to last about 3 months. So when you do Botox or Disport, have it done, get back in before all the strength comes back, and then it will last longer, be a better value to you. For some people, a few people, Disport does seem to last maybe a couple weeks longer than Botox, but they're really close. So Botox, a little bit more of a frozen feel. Disport's a little bit softer feel. In a few people, the Disport may last a little bit longer. Again, that's just a toxin that stops the release of acetylcholine from the end of the nerves, so the muscles do not contract, does not injure the muscles, does not injure the muscles. And Botox eventually will just be broken down, metabolized by your body, and it'll be gone. This isn't a heavy metal or something that stays in your body forever. Your body will eventually just break it down, and it will go away. Botox and Disport has been injected in millions of people, and there's been no long-term problems or health problems from the injections of the Botox or the Disport. They're very, very safe products. They've been used in millions of people, and it's been shown to be very, very safe. The amount of Botox or Disport that we inject is just microscopic amounts, just teeny tiny amounts. In order for us to actually get to a toxic level, we'd have to open multiple vials of Botox or Disport. It's literally impossible to get to a toxic level on these injections. It's such a fraction of the amount that it would take to be at a toxic level. It just can't happen. So a very safe and a very, very effective treatment at helping you take away some wrinkles on your face. I'm going to talk now about just the areas that we use Botox or Disport and things we can do with these products. Here at Learn and Lunch, we're trying to address things that bother you on the outside and on the inside and give you some solutions to those problems to help you help with those problems. So with Botox or Dysport, the areas that we treat are the forehead. That's a very common complaint, is the wrinkles on the forehead. We will do across the forehead to treat that muscle. The other areas, the other wrinkles that we can treat with Botox or Dysport is this area through here, the glabella. That's probably the most common area we treat. That's the area where most people, that's their main complaint, is the wrinkles through here on most people. The other areas we treat is around the eyes and the wrinkles under the eyes. We can treat this area. Under the eye, the Botox or Dysport has to go very superficial, right under the skin. It can't go below the muscle. There's another muscle below this muscle that if you hit, that lower eyelid can do strange things. But if we do it the correct way, really nice, effective treatment around the sides of the eyes. Wrinkles on the nose, we call them just the bunny lines or bunny wrinkles. Botox works really well there. The other areas we treat with Botox is the lip. About 5% of the time it doesn't work on the lip, it doesn't take it out. About 5 or 10% of the time women don't like how it feels. But most women absolutely love the Botox or Dysport across the lip. It softens those wrinkles up. The other area you treat is the chin. Some people get kind of the orange pill texture chin. Botox and Dysport works excellent there to just smooth your chin out. One of my favorite injections is the frown over here. Some people will get a little wrinkle right here, and the corners of their mouth turn down. The muscle that turns the corner of the mouth down goes from here down to here, and doing some injections across here works great to bring that frown back up, take away this wrinkle. You have to be really careful not to hit the muscle in here. That makes your smile strange. The other thing we do with Botox is what some people, they have gummy smiles. When they smile, all their teeth and their gum shows, and it really bothers them. The muscle that raises your lip comes from way up here down to your lip and right here next to the nose. It passes just under the skin. A couple units here and a couple units here. Does a really nice job at keeping that lip down so that you don't see all the teeth and the gums when someone smiles. Excellent, really nice treatment. The other area we treat is on the underarms. A really embarrassing, stressful problem for some of our patients is they sweat a lot. Botox works excellent on the underarms to take away sweating. When we inject the face, it lasts 3 to 4 months. For some reason, when we inject on the underarms, it lasts 6 months or even longer. It works very well. It just completely takes away sweating and can be life-changing for some people. The other treatment that we do is we treat for headaches. The neurologists, they will inject back of the neck and the top of the head. We don't do that here in our clinic. But if someone's headache starts here around the eye, around the side of the eye, or one side of their face, if we inject those areas with Botox or Dysport, the frequency of the headaches gets cut in half. If you have a headache every week, you will, almost on all of our patients, the frequency will go to maybe 2 headaches a month. On some of our patients, when we inject these areas for headaches, their headaches completely go away. So really great treatment for someone who has migraine headaches. Will definitely decrease the frequency of the headaches. So yes, with Botox and Dysport, really amazing, safe products that our patients just absolutely love and can help address some of these wrinkles and headaches, sweating, and just works really well and a very, very safe product. So on Chris today, we're just going to just show you how quick and easy this can be. We're actually going to be using Dysport. Her Dysport is just starting to wear off. She's maybe a few weeks early to do this, but just to show you how quick and easy this is, we're going to go ahead and do this on her. Okay, Chris. I'm going to have you lift your eyebrows. Okay, relax. Have you lift your eyebrows. Okay, relax. use just a very teeny tiny needle. It's quick and easy. The forehead doesn't hurt at all. The sides of the eyes really don't hurt very much. It's a little sensitive through here, but it's very quick. So anyways, that's our Learn at Lunch. Tune in next week on Monday afternoon. We'll talk about another problem and give you some really good solutions. Have a great week. Thanks for joining us today.